Respected Chair, Honorable Dignitaries, and my dear colleagues, I am Dr. Satish from NIMS Institute of Medical Sciences. I am going to present carotid artery intimal medial thickness plaque score and its prediction with the syntax score 1 and 2. Coming to the introduction, cardiovascular disease are the most significant cause of morbidity and mortality in India, and coronary artery disease remains the most alarming form of the cardiovascular disease, with sharp increase in prevalence in the recent Indian subcontinent. And the prevalence of CAD in India is around 3 to 4% in rural and 8 to 10% in urban India. And further, the incidence rate remains high with 47 new million cases adding every year, and the mortality is 2.3 million. A multifactorial disease, it resulting from interaction of multiple risk factors. Hence, it is important to study the disease rather than risk factors, and study being the atherosclerosis. Although risk assessment on non-invasive testing are done prior to any interventions, but they remain insufficient. In this regard, several surrogate end markers of the disease course and disease response have emerged, and among them the intimal medial thickness and plaque score via the ultrasound are most validated atherosclerotic imaging techniques, and it is as it is very feasible and widely available, and it is also highly reproducible, and many studies have shown association between intimal medial thickness and old cardiovascular imaging scoring systems such as syntax 1. And the carotid ultrasound findings are significant surrogate markers for cardiovascular risk. Coming to the syntax score 2, it is an updated of established syntax score that uses clinical variables such as age, sex, creatinine clearance, LV ejection fraction, COPD, and also peripheral arterial disease, which are also the common causes for systemic inflammation. And it is additionally proven that syntax score 2 is a powerful predictive tool than syntax score. Coming to the objectives, the study aims to determine the anatomical severity of CAD and the patient clinical features using syntax score 2, and the carotid artery stenosis using intimal medial thickness and plaque score. A prospective analysis of 220 patients were taken who are undergoing elective angiography for chronic stable angina, and a history of acute coronary syndrome, and patients who underwent revascularization were excluded from the study. And syntax score 2 calculation was calculated online, and 2 cardiologists were enrolled and who were blinded for the results of carotid ultrasound intimal medial thickness and the plaque score. Based on the angiogram, more than 50% diameter stenosis was scored. And for intimal medial thickness, near and far walls of the common carotid artery were taken. And for carotid ultrasound, we use the intimal medial thickness, that is luminal intimal distance between the luminal intimal distance and the adventitial medial thickness was taken as intimal medial thickness. And statistical analysis was performed using SPSS version. And this is the measurement of plaque score. It was taken. Plaque score is taken as A, B, and C, and also thickness of the contralateral carotid arteries were taken into account. And this was 15 millimeters away from the bifurcation is the S1, and S2 is 15 minutes prior to 15 mm prior to bifurcation, and so on. And this is the calculation of syntax score in anatomical severity and complex. This is the syntax score 1. And these are the patient characteristics, and overall 220 patients were taken into the study. Among them, the plaque score was 3 plus or minus 2.7, and the intermediate risk and high risk were 17 and 12 patients. And the predictors of coronary artery disease were plaque score has a significant p-value of 0.01, and the predictor of patients with intermediate risk score where plaque score was again significant with a p-value of 0.12, and syntax score with Spearman's correlation was significant both with intimal medial thickness and plaque score. And this is the Pearson correlation graph, which was showing positive linear correlation between syntax and plaque score, and there is a receiver operator curve showing positive correlation between the group 1, that is plaque score. And this is the syntax 2 score format, which predicts the 4-year mortality based on anatomical clinical factors. And this is the correlation between syntax 2 and the intimal medial thickness, which shows a positive correlation. And the results were mean syntax score was 20 plus or minus 11.3, and intimal medial thickness was 0.85. And the correlation between syntax score 2, and intimal medial thickness using Pearson correlation showed a strong positive correlation, and also there was no significant difference between the two sexes. The correlation between CAD and risk factors is well established, but intimal medial thickness is also established. However, CAD complexity and CMT is not well established. In this prospective study, we studied the correlation between anatomical severity of CAD and the patient clinical factors using syntax score 2 and the carotid artery stenosis using CIMT in stable CAD patients who underwent elective CAG. The main findings that it showed a positive correlation between syntax score 2, which reflects the complexity, and the patient clinical factors. In accordance with our study, Bryansky et al. Showed that carotid intimal medial thickness is positively correlated with syntax score, and in a similar study, Sai et al. Demonstrated a significant relation between complex carotid plaques and complex CAD. And Aikida et al. Have depicted that overall syntax score as 8.1 plus or minus 14.4, and intimal medial thickness was 0.86 plus or minus 0.23. Although their syntax score is lower than the syntax score we have reported, they found a significant relationship between the syntax score and intimal medial thickness, which is in line with our study with the Spearman's rank correlation coefficient of 0.4, which suggests a positive linear correlation. And many of them have had carotid ultrasound, which predict the prognosis and risk of cardiovascular events. In our study, we reported a positive correlation of intimal medial thickness with syntax score and also syntax score 2, and we specifically added syntax score to make that CMT is more reliable, and also it also takes the patient's clinical factors. Positive correlation with syntax score makes the CMT a more reliable and predictive test for CAD, since syntax score 2 is more validated than the anatomical syntax score 1. Given the positive correlation in our study, intimal medial thickness is a simple non-invasive test with good potential of becoming a good indicator of complexity of CAD in selected patients, and therefore further research on this topic will be meaningful. Coming to the limitations, study consisted of relatively small size, and the average syntax score of the included patients was relatively low, and the patient in our study were likely to have ischemic heart disease, and these patients have relatively high risk than normal healthy population, so it can't be attributed to the general population and useful in screening. In conclusion, the current study showed that combination of all anatomical complexity of coronary artery disease and patient's clinical factors using syntax score 2 has a strong correlation with carotid stenosis as assessed by intimal medial thickness. In patients with stable ischemic heart disease, carotid ultrasound findings correlate with the degree of complexity of CAD and thus help to prognosticate the CAD patients with almost sensitivity of 94.7%. Given the negative impact of atherosclerosis and coronary artery complex on cardiovascular events, further studies are needed to confirm that intimal medial thickness can be used as a screening test for complex CAD. The mean intimal medial thickness and the plaque score increases with the increasing syntax score, and patients with intermediate and high syntax score have higher mean intermediate intimal medial thickness and plaque score as compared to the patients with low syntax score. Further studies with large number of patients having a higher syntax 2 score on an average will be definitely support to this study to enlighten our hypothesis. Thank you, sir.